It's my honor and my privilege to introduce Dr. Charles Bransford, who likes to be called Chuck. So I hope I'm not being disrespectful when I refer to him as Chuck. He likes that. So, Dr. Bransford is board certified in internal medicine since 1981. He's board certified in hospice palliative care medicine since 2006. Chuck has practiced medicine in the Stillwater area for 40 years. His practice is the same age as our grief program. We launched at the same time, Chuck. He was Lakeview Home Care and Hospice Medical Director for 12 years. Dr. Bransford was Director of Washington County Public Health, retiring just before COVID. He says, thank God. His wife is Dr. Diane Dahl, and she was with us as a facilitator in the first series. We hope to get her back, and she's here to cheer her husband on, and if it's more like most husband-wife teams, she might also kind of straighten him out on whatever is that true? His wife is Diane Dahl. She is with us tonight. His daughters are Elaine and Amanda. His grandson is Nico, who's now age 16. Charlie, who's age 13, let us pray. Well, wait a minute, that's a Christian thing to say. Wait. And lately, the new one, Selena Diane, is just barely 5 weeks old. So welcome, Dr. Charles Bransford. He belongs to us, and this community belongs to him. Thank you.
Nice to see you all. Can you hear me okay? Okay. I've got the timer set for exactly 45 minutes. It can't go longer. A lot of familiar faces. It's just wonderful to see you. If you would like, feel free to come down closer, especially because my speaking technique is when I come to something really important, I mumble. So when you look at that first picture up there, this comes from Burnside Lake in northern Minnesota, kind of on the border of the Boundary Waters, taken by Rob McKim. Rob, would you raise your hand? He's a great photographer, and I really appreciate the picture. The reason I want to start with this picture is that I think it is the key to surviving grief, living with grief. And that is this ability to find a way to help yourself relax, finding a way to get yourself centered again, because the grieving process always puts you into the stress side. And I want to go through that a little bit here. So in our bodies, we have the consciousness, right? And then we have the brainstem and this thing called the autonomic nervous system, which is brainstem and below. And that is all unconscious control. And it is prehistoric. It goes from every cell line going up to all creatures have this autonomic system. If you didn't have it, you'd have to time your breathing. You'd have to say, okay, digest the hamburger now, let's see. You know, it's all unconscious, and it is strongly affected by grief. And that'll be the main topic tonight, is how this happens. Because it's so powerful, and yet you don't realize it's happening. And when you look at that picture, I want you to think about, there's kind of two sides to this autonomic system. There's the sympathetic system, which is what happens when we get up in the morning, we have a cup of coffee, and we start to think and plan and think about the day and what's important. That's our sympathetic system kicking in. That's what we do reasoning. That's what we do when we're trying to figure out what we want to do that day, what's important. And we live within the sympathetic system most of the time. On the other side is this wonderful part of our nervous system called the parasympathetic system. Now, these two systems are supposed to be in balance together, sympathetic, parasympathetic. And our heart rate even shows this. There's this thing called the heart rate variability index, which is where you think your heart rate is regular, but it's actually not when you're in sync. It's going back and forth, and that's this rhythm between the autonomic nervous system, between the sympathetic system and the parasympathetic. A picture like this helps bring out the parasympathetic system. You kind of know you're there when you feel your heart feeling warm, when you feel a little bit relaxed. And when grief strikes, it drives you out of this parasympathetic system and deeply into the sympathetic system. And that is very hard. This is my picture from the river, and this is a great blue heron. And you can see that it's just lifted off a branch, and it is kind of floating in midair. And in the next second, it opens up its antediluvian wings and flies away. But for that moment, it's just right there, and I just love that bird, and I would love for all of us to be able to have that sensation of being able to be connected with the world. You also might notice that its shape is like the Concorde airliner. So let's start right in. Let's say, what are the medical effects of grief? Grief is, right? We can't reason it away. We can't make it go away. It happens when we have a loss. And after age 65, in widowhood, which means either the man losing his wife or the wife losing her husband, in the first year after the death of a spouse, the male has a 70% increase in death rate compared to a married peer. So if I'm thinking about, let's say, me and my brother, and we are similar risk factors, like, same weight, same cholesterol, same family history, and if I die, then I have a 70% increase of dying in that year ahead compared to him. That's a lot. That's really a lot. So that's quite shocking, and that's because of this autonomic nervous system. It's because the hormones of grief drive us into this sympathetic system, and that is bad for us. Women also have the same thing, but only at a 27% increase. So one of the mysteries is, why is it so much more intense for men? I think we can all have some theories about it, right? Yeah. More than theories, right? Yeah. So what does happen when we go into the sympathetic system? And what happens, which we'll talk about down the road, is we release the hormones of grief. Epinephrine, cortisol are the two big ones. And when that happens, it drives our blood pressure up. It drives up our pulse rate. It takes us out of this heart rate variability. It's pro-inflammatory. It's increased clotting. You might say, why would grief have us do increased clotting? It's interesting to think back when you think about history and human survival, and you realize if you are attacked by a tiger, it's good not to bleed. So all these things really have quite a history to them that it makes sense when you go back in time. So grief is not a disease, and we cannot cure it. And I'll tell you, as a physician, that has taken me a long time to accept. I thought, what we're going to do is get this person over this. I got to give him a shot or something, some way to make this go away. But on the other hand, it's really important to know, since there is this increase in death rate from these complications, particularly stroke and heart attack, what are the things that we can do to help minimize that? And by far the most important thing is if we can get this sympathetic system and parasympathetic system in some kind of balance. And each one of you has to find your own way there, because what works for me will not work for you. Walking is a great thing, music for some people, writing for others. There are so many different ways that you can get yourself back into balance, and you have to look for it, you have to work for it. There are a lot of things that happen to us that will get us into deep trouble. The biggest one, I would say, is alcohol use. Really tough not to do that, right? So again, those are the medical effects of grief, and I want to show you kind of some of the hormonal relationships that cause that. First, it's my dog Sam, half Welsh Corgi, half Jack Russell, we think. And we're going to talk about the physiology of grief. What goes on that drives us into this sympathetic system, and why is it so hard? And grief is a feral animal. I have learned not to resist. That's from the poet Maya Stein. And you have to remember that grief is irrational. Grief is irrational. You can't explain it away. You can't use any kind of psychological technique to make it not be there. It's going to be there. This is Sam after hearing my talk for the 50th time. He said, okay, Chuck, yeah, he doesn't do it, you know. But he did say something very important. He said that you can never have a good talk that's too long. So I got the timer going. So when we think about, since grief is irrational, I find that metaphors are a really good way to try to understand it. And my first metaphor is the metaphor of the bridge. And this is the High Bridge north of Stillwater over the St. Croix River. I love this picture. There's a train going across it, and you can see on my far right that one of the cars is empty. And that's kind of us as we settle onto this bridge of grief. And we're trying to find a new way to be, right? We've got a loss, and things are not the same. So you might think, well, so is the bridge the purpose to get across it? And the answer to that is no. In my image, there are two sides of the bridge. One side is the loss. Okay, we'll put that on the right side. And the other side is love. You can't have loss without love. And so there's this bridge between them, and it's a bridge of communication. Okay? So it's communication. And if you stay on the love side, and you start thinking about what you lost and kind of immortalizing it, which we often do, right? The person we've lost becomes this great superhuman, or if we had a job that we lost, that becomes the greatest thing since sliced bread. And some of the research has shown that if you lose a partner and you go back and try to have another partner, that another partner has to be 100% better than the other one. So it's a big road to climb. You sort of got to just recognize that. And the farther you get trapped into that, you can really immortalize this loss and make you paralyzed, okay? So that's one side of the bridge. The other side of the bridge is loss, the loss itself, okay? So there's this communication. The loss itself is something that, as a man, I have always tried to block out. You know, you just pull up your bootstraps and get going, and that's how you manage it, right? So what happens if you do that? The trouble is you lose the love. So if you block out this loss, then all the memories of the love that you had for the thing you lost, the person, the job, is gone. And there is nothing worse than that. And I think that is probably the male response most of the time. This, let's see, I think most of you are in my age group have probably seen a Western or two. And this is the stagecoach metaphor. And it comes from Amor Towles' last book. And he calls grief a stagecoach. And I just love this. So if you think about it, as you have had your loss, you decide that you're going to go out west and start a new life. And so you get into the stagecoach, and the first question is, who's in there with you? Right? And is it people you want in there? Sometimes you have no control, right? And all these friends and relatives, and crazy Aunt Edna comes from California, and they're all going to help you out. And you're trapped in this little thing, and you're bouncing across the prairie as you head out west trying to make it. So my first question to all of you is, who's in your stagecoach? And then, how long are they staying? And then another thing is, who's chasing you? Because you're always in these westerns running along being chased by bandits, right? And the other thing I love about it is the idea of the way station. I don't know if you remember that, but you'd be going along. You can't make it all the way to the West Coast without stopping, right? So you come to a farmhouse in the middle of a field, and there's this couple, and they're really crabby, and that's your first way station, right? And that is a big part of grief. You start out and you come to a way station. Let's say you go through a divorce. The first thing, maybe you get an apartment, and then maybe the next way station is more of a condo, and then if you're really lucky, maybe you get your own home. But I want you to think about also the way stations that you've had along the way with your grief, and maybe where the next one will be. So who's in it? Who's in this stagecoach with you? Who's driving? And how many way stations have you been to, and how many more will you need? So is grief good or bad? I would say neither, right? Yeah. It just is. A natural, universal response to loss of something you loved. Personal response to loss. And it's a process, not a state of being. A process, not a state of being. Grief is the emotional, cognitive, functional, behavioral response to loss, which says a lot. This, I really, through most of my career, I never thought of grief as a healing balm. To me, it was always a bad thing. Here's this person crying and in my room and they're upset, and how can that be a healing balm? But as I've looked at it more and more, I realize it is. The loss is the wound and grief is the healing. And it is an ancient, ancient remedy that has been going on forever and ever and ever. Elizabeth Kubler-Ross was a person that was the only person when I went through medical school who talked about death and dying. And she had this shocking idea of actually talking to people when they were dying. This would be in the 1960s. And she came up with what were eventually determined to be stages of dying, which is totally wrong. But what she did describe was that there were things that people went through that were denial, anger, depression, bargaining, acceptance, guilt. So these were things that people commonly dealt with. We as physicians wanted it to be a thing that you got over, right? You worked from one stage to the next stage to the next stage, and you all know it's not that way. It's not that way. Instead of stages, I love the idea of waves. And isn't that the way it feels? When you suddenly have a memory of the person you lost, you get this rush of emotion that just comes over your body, and that's the wave. So what triggers the wave? Hormones. What triggers the hormones? So first the loss. If you think about what happened, let's say you lost a loved one in a tragic accident and the police come to your door. That is the first moment, the first loss, and your body reacts with this horrendous grief response, which we're going to go through in a minute. But there are many different ways that grief response can be triggered. It can happen from smells, sounds, train whistles, visual memories, sensations, tastes, dreams. All can be a little fire that gets turned on, and then this release of the wave of emotion of grief. Anybody had that? Just a few, yeah. They're like little pilot lights that get turned to high in an instant, or the accelerator on your car suddenly pushed to max. A wave of confusing, contradictory emotions. Like little fires everywhere. Emotions can produce a deep sense of longing, of love, maybe anger, sadness, a sense of connection, maybe all at the same time. The heart is really interesting because it is strongly connected to the brain. And there's more connections from the heart to the brain by 80% versus brain to heart. The heart is a secondary brain, and it has nodes there that respond to the hormones of emotion more than other parts of the body. And so when you release epinephrine or cortisol, they will trigger more response in the heart than in other places. And that's why you feel that warm burning, that sense of brokenness, all the things that go on so suddenly in your heart. There also are nodes up in your throat. And so you have this feeling of tightness, sometimes of shortness of breath. Sometimes you lose your voice. And there are these same nodes in your gut. And that's a place where a lot of us feel this hormone, the grief. And that is a lot of anger goes there, a lot of anxiety. So think about those three places and where you may be feeling that, feeling your grief, and realize that these are the places where the hormones of grief are attaching. Anybody recognize the album cover? This is Derek and the Dominoes, Layla. Yeah. And for me, one of the things that happens in grief is that you have more dreams and more visions. You have more thoughts per second. The hormones of cortisol and epinephrine get your mind going, and you also can't sleep. And during the day, we call them delusions and hallucinations sometimes. So what is the evolutionary purpose of grief? I think this is really important when you think about why is this happening? Why would my body do this to me? Why would I have this memory, and why would I have this horrible feeling of loss and tears and all the things that happen? Why is the body doing this? Well, the first thing is survival. You know, this goes back to prehistoric times. If you are a caveman, you know, you want to learn how to protect yourself and your small family, and you want to know how to prevent it from happening again. So these hormones help you mark the experience so that you know how to prevent it in the future. That make sense? Okay. Later on, and this was fascinating to me, we as human beings formed societies, right? And we can no longer live alone. And as the grief response has evolved, it has added in the hormones of connection. And that's a hormone called oxytocin. And so not only do you have this difficulty with fighting off the predator, you then have to figure out how do you make your community new after the predator's gone. What are hormones? Hormones are just little peptides that are released into the bloodstream to communicate with other organs under unconscious control. Okay? Now, this is my favorite slide. So prepare for pain, as my daughter used to say. I hope this makes sense, and I hope you find it interesting. I just want it to be something to have you get a sense of what might be going on, okay? So these are the major hormones of grief. So when you are triggered, you have like for me, I'm thinking about a cribbage board. I had a good friend who we played cribbage all the time, and after he died, every time I saw a cribbage board, it would trigger my grief response. So what happens when there's a trigger? It starts from the brain, and there's a neural pathway that goes to the brain stem, and then from the brain stem, hormones are released to communicate to the rest of the body that something significant has happened, okay? So the first thing we're going to talk about is epinephrine. Adrenaline, you all know that hormone. It's the one that happens when a car cuts in front of you and you have to stop suddenly. You know, that you are releasing epinephrine to make you as alert and strong and powerful as you can possibly be, as fast as possible, okay? And that's the first thing that's released in the grief response. And it's amazing because it is all, it's like a broadband cable. It runs right from the hypothalamus to the spinal cord, all the way down, and then divides out and goes to the adrenal glands, which are right on top of both kidneys, okay? The biggest endocrine structures we have in our body. And it's all neural, so that it will be as fast as if I say, raise my right finger, right? That's a neural connection. It's immediate, it's very specific, and that's how epinephrine is released. So it happens almost like that, and it has to, because that's how you survive, right? Okay? So that's number one in the cascade. Oh, we're doing okay on time. Okay. Secondly, what happens is that from the brainstem again, a little peptide is released, and it goes down to the pituitary gland. And the pituitary gland is right here. It's like an upside-down balloon. It's kind of the general for the hormonal system. And it then sends out a little peptide that goes to the adrenal gland again. But instead of it being in the central part, it's in the periphery, and it triggers the release of cortisol. So epinephrine and then cortisol. And why do you need the cortisol? Cortisol is necessary to provide the energy for the epinephrine to keep working. It's like the gas. Without it, we can't survive, we can't function, and we need lots and lots of cortisol during stress, okay? And we get lots of it. And because it's such a huge gland, it's one of the biggest production hormones that we have in our body. You think any of you have ever taken cortisone? I bet everybody in this room has. You take it if you have an allergic reaction, prednisone, Medrol dose pack, headache, allergic reaction, asthma. It's used a ton, and I know that most of you have had a cortisone shot. The backbone of orthopedics comes from cortisol. What an amazing thing. It was discovered in 1935 at the Mayo Clinic. Nobel Prize in 1950. And in 1950, they discovered that it is the most amazing anti-inflammatory drug ever. And they had these people with very aggressive rheumatoid arthritis, gave them prednisone, and within a few days, they were able to walk when they couldn't before. And it was dramatic pictures. And people thought we had the cure for all autoimmune diseases and rheumatoid arthritis. Unfortunately, if you know prednisone, you know that it has a horrific amount of side effects. And so as time has gone by, we've had to learn how to work with it. But it's a remarkably powerful drug. And it is released in the grief response to a huge degree. So both epinephrine, cortisol will stay high probably for at least 6 months. So it's tough on you, yeah. The third one, okay, as we head down this cascade, is oxytocin. And oxytocin is the hormone of connection. So the place I think you can best understand it is when a mother delivers a child, it's a vaginal delivery, and they take the baby and put that baby on her chest. Both the baby and the mother produce sky-high amounts of oxytocin, and that's the bonding rate. Those two bond because of that hormone. Cool thing. And again, it's along the evolutionary scale. It's a later thing that the human organisms kind of learned about how to make connection, and that's oxytocin. Does it happen in males? Yes. So there was a great Swedish study where there's this picture of this huge Swedish biker. And he's got long hair and a long beard, tattoos everywhere. And there's this little baby on his chest. And he has this exquisite smile and tears in his eyes. And you know that he loves this child and will forever. That's the bond of oxytocin. It's quite a remarkable thing. Remember that all these hormonal effects are unconscious. But you are not the same person when you're on the sympathetic side versus the parasympathetic side. You think differently. The parts of your brain that you use are different. So it's so important to remember that. When you're in grief, as you know, sometimes you behave crazily and you have no idea why. It's because you're over in this sympathetic side, okay? One of the questions people asked me last time is, what about these hormonal effects over time, and are they different in different traumas? And they are. They're hugely different. Basically, what you would see is that the more acute the trauma, the more, let's say you're in a very bad car accident and you see the person in front of you die and you're injured, your epinephrine level is going to be sky high. And because of that, your risk of having shock is much higher. When the epinephrine goes way high, then you deplete blood sugar from your muscles, your vessels are in spasm, and there may not be enough energy for your muscles to function. So in acute trauma, we really like to get people into an emergency room because there are three things that happen are, even if you're not injured, If you've had this traumatic experience, you have this feeling of fight or flight. You have the feeling of fainting, which is what will happen. And again, that goes way back in history. Fainting would be used by a person or an animal because when they are caught by the tiger and they are going to be eaten, they play dead. And then the tiger maybe will set them down and come back later and they can get away. So the fainting response is a long, historic process. So any questions, any comments, I'll also take questions at the end because I know this is a lot of stuff. Remember the timeline here. This is what's so interesting, is that epinephrine right away, then cortisol, and then oxytocin is a little bit later. And there isn't as much oxytocin as there is cortisol. So you wouldn't want to have too much oxytocin right during the trauma, right? You don't want to be fighting with this tiger and have to say, oh, it's kind of a nice day. Does that make sense? So it's quite remarkable, you know? Yes?
The grief responses are parasympathetic.
Sympathetic, yep. The question is, are these hormonal responses sympathetic or parasympathetic? The oxytocin, you're right, could be parasympathetic. But the first two, epinephrine and cortisol, are strongly sympathetic. They're the ones that are getting you to rush out there and save the day. Okay. Yeah, that's right. Coffee, right. And then the fourth one, which I just want to mention, are endorphins. And endorphins are natural opioids that our body makes both at the tissue level and in our brain. So if I break my arm and I get this terrible pain, my body produces endorphins right there and it becomes numb for a while. That's the saving opioid. And it's also in the brain. So, people were pretty smart and they recognized that opioids were very, very helpful in acute pain, and we all know the story there, right? Yeah. So epinephrine, cortisol, oxytocin, and endorphins. Those are the hormones that are pouring out during our grief response. So I want to mention a little bit of time. Let's see how we're doing. Oh, we're doing great. Okay. So there's a thing called the broken heart syndrome, fairly newly discovered. And this is the situation where there is an acute trauma. And I would say that it would be a situation where you release a ton of epinephrine because it's just so painful for you. Whatever happened, it's just horrible. And so you release all the epinephrine. Your body releases the cortisol, but it's not enough to overcome the epinephrine, and the muscles run out of energy and they become paralyzed. And in the heart, then what happens is the person really goes into heart failure. And it's an acute medical emergency. In the emergency room, that can be treated quite well with IV fluids, with some sugar, and a drug called a beta blocker. And what a beta blocker does is it blocks the effects of epinephrine. So the reason it's called the broken heart syndrome is it has a unique appearance to it. It's called a Takotsubo heart, excuse my pronunciation, but it's a Japanese lobster trap. And that's what it looks like. It's like asymmetric. And this is treatable. And people can get over it, but it also is life-threatening if it's not. Here's the interesting thing. So as we said, men are 70% more likely to die in the first year, right? So this broken heart syndrome is 80% in women. How about that? Yeah. So maybe that's, again, that fact that women are more connected. Maybe the oxytocin, for whatever reason, this is much more common in women. So grief helps us remember the important things. It's like, if you think about your memory, and you pour it out there, how in the world do you mark the important things? Well, grief does that. There's this wave of emotion and grief and loss, and I think we've talked about that. Steroids plus the hormones of fear and anxiety, epinephrine, make us feel outside ourselves. And I know you've all either experienced it or had it happen to you. And in our society where there's so much pain, so much suffering going on, this is one of the big results. And I think we have to recognize that in our society and find ways to calm it down. The hormone of attachment is this wonderful oxytocin. You know, we're not alone. It's out there to help us. And I love the vision of the baby and her mom. And that's the place where you can think about attachment. It's interesting. The one place that they are using, of course, you can imagine there's tons of research with all these hormones because everybody wants the perfect happy pill, right? Everybody wants the antidepressant. Everybody wants the hormone of attachment, but it's pretty complicated. The one place is in autism, where they're starting to use oxytocin in young people in hopes that it'll help the autistic child learn how to connect. So that's pretty exciting, but it's all very early. Human tears. Human tears show us this mixture that we've talked about today. Because you cry and you laugh and you have tears both ways and they're exactly the same. And the lacrimal glands are just right down from where all those hormones come out. And so the hormones pour out and they hit the lacrimal glands before they hit the body. So you're crying before you even know why. Everyone is trying to figure out, well, what's the tier complex of happiness versus sorrow, and they can't tell. So I did want to just mention, we're getting close to the end. 9 minutes to go, thank God. Okay, everybody hold it up okay? Hope this is okay. It's important to know your pre-existing conditions because in this time of grief, you are at increased risk for complications to your health. And so you want to look at your own self and say, well, if I've got high blood pressure, I need to get that checked now because it may need a change in medication. If I'm diabetic, cortisol makes diabetes a lot worse. And so I want to make sure I'm doing okay with that. Any of those things, clotting disorders, all of those are important to know so that you can deal your best with it. Hydration, what a simple thing to do, makes a big, big difference in your risk for clotting. I'm going to skip this. So hormones are triggered from the brainstem, as we've talked about. Cortisol is just one of the most fascinating compounds that I have ever come across. I think in my career, my friends used to call me Dr. Prednisone because I used it a lot, and it was both my greatest friend and my greatest enemy. I had to be so careful with it, but it was one of the medicines I could use in the right setting that would help someone out so immensely. Interestingly, when you take cortisone, what happens to your adrenal glands? They shrink. If you're taking cortisone externally, then the adrenals stop making it internally. And so you have to be really careful with what you do with cortisone. You have to take it in a very controlled dose, and when you wean off of it, you have to go slowly. Very, very important. Cortisone shots. When you get a hip injection, you get a lot of absorption. And that's why a lot of people won't allow elective surgery for quite a period of time after a shot, because the cortisone effects last a long time. If you're having surgery and you've had a cortisone shot, the anesthesiologist will give you more cortisone to make sure you got enough. I think if I have a new life, I'm going to study cortisone. Quick thing on PTSD, okay? So post-traumatic stress disorder. When we think about this This picture I've talked to you about the hormones. In PTSD, we would say that the epinephrine level was so high, there was so much stress, that the only way the person could survive was by walling off the memory. So this is the Great Wall of China, and that's what happens in your brain. You just completely wall that memory off so that you cannot remember it. But those of you who suffer from PTSD know that it comes back at times. The cost of walling off unpleasant experiences is extremely, extremely high. In the world of grief, the problem is that you can't go through the process. You can't start having the other memories that occurred that were good about the person you lost. The reason you love them. I had a patient when I was early in practice who was a World War II vet in the Battle of Bulge. He came in with a stroke, and all of a sudden he was there in the Battle of the Bulge. He had suppressed it all his life, but the stroke broke the suppression, and there he was. So we humans are resilient. We're like nature. We can, here in Stillwater, it took us about 100 years to wipe out the white pines and fill up the river, and another 100, and here we are. So this is important to me. I'm going to leave it with this slide, and then I'll read you a poem, okay? That sound good? We doing okay time-wise? Not causing trouble? Okay, all right. So, without love, there can be no grief. So you wouldn't be here tonight if there hadn't been someone, something that you loved. And so, what a gift. And even though it's so painful that love is gone now, the memory is there with you. And in my mind, we do not grieve without hope. And if I was going to do another topic, it would be on what is the anatomy of hope? What is it that gives us hope? I think it's a wonderful thing to think about. Often our loved ones are teaching us how to love through grief. The alchemy of love is an internal process involving both the heart and the mind, so trust the process. We actually transform the world from within our own hearts. That's Rainer Maria Rilke from 1920. And this is my favorite. I want to leave this with you. Grief provides an element of immortality to your loss. Does that make sense? Okay. All right. So I'm gonna read a poem. I wrote this poem soon after I started working in the Grief Coalition, which has been quite an experience for me, and I really appreciate it. And it's called The Wound and the Balm. In the consummate stew of life, grief wedges between the ingredients of loss, flavoring them with a bite like jalapeno peppers. Suffering, eventually, brings this stew to a boil. Our throat burns, tears run, kaleidoscope of the predictably unpredictable. Grief's constant love, love's smoldering latency, grief. That clopping, horse-drawn hearse, stirrups turned backwards, seen through the eyes of a saluting boy. Encompassed by love, trapped in a single tear, our broken-hearted grief assembles hope out of the ashes of anguish, the wound and the balm. Thank you.